Have you ever been all alone in a room and you really want to be around people, but you don't have the urge to go out or to get up? Have you ever been sitting in a classroom and you stare off into space and you're not listening to the teacher? Have you ever been in a room full of people and yet feel so alone? This can be a sign of depression. Depression is a mood swing disorder with a persistent feeling of sadness or a lack of interest. According to the National Network Depression Center, the leading cause of disability amongst the age 15 and 44 is depression. Everyone will go through depression at some form or stage in their life. You have to know the signs, the risk factors, and the treatment to overcome depression. Some signs of depression can include mood swings, behavior, or a change in appetite. Some mood swings can consist of you have a friend and she's always upbeat and smiling, and then she just turns a whole different 360 and she's not as happy or she's not as persistent or as prioritized as she was. She lacks that. That may be a form of depression. A behavior change can be when your friend is academically involved in school or in the community with the community programs and organizations, and they just fell off. They don't go to the meetings, they don't check on the things that they feel that is priority to them. That can be a sign of depression. A change in appetite, a weight up and down, it fluctuates, or not eating at all. This can also be a form of depression. Noticing the risk factors, family, life trauma, or illness has struck upon you are signs and are factors that can affect you and make you have depression. Some life trauma examples will be death or maybe a car accident. The car accident caused the death, and the person is depressed because that person has died, or the car wreck left them paralyzed, waist down, and they're depressed because they cannot walk again. That can be a sign or a risk factor of depression. A illness has struck, and like cancer or leukemia, something that you can't control. Some people, when they have cancer, they just shut down and they get depressed because they no longer want to live knowing that they're going to die soon. And depression is also inherited from father or mother, family related risk factor that can also be a depression when dealing with depression. You have to be able to recognize all these signs and risk factors so you can know which treatment works best for you. During these treatments, there are three different kinds. You can experience therapy, a change in daily activity, or medication. Some therapies may consist of going to counselors, speaking with someone about your problems, about depression, opening up to someone and talking to them about the thoughts that goes on to your head is always a good way to overcome depression. A change in daily activity. Maybe you can add a morning jog in or a yoga class to help you get out the house. Sometimes being in the house can be that form, can be what's making you depressed because you're so sheltered in your home and you're just getting depressed by being there. So changing your daily activity and adding something that you like to do can get you out of that. Or maybe medication. Medication is another form of treatment people use to help them with depression. Depression people sometimes have hard time sleeping or with energy or having energy, so the medication can help them with that. It can help them sleep better at night or help them give a little bit of more energy. So, being able to overcome depression, you have to realize all these signs, the risk factors, and the treatment to overcome it. 16.2 million adults in the year of 2016 suffered from depression, according to the National Institution of Mental Health. This is roughly 6.7% of the U.S. population that suffered from depression in 2016. Just imagine how many more people that would have got affected with depression that wasn't counted in 2016. We are in the year of 2020 now, and the rise of depression is going up. In order for this to be controlled, again, we have to recognize the risk factors, the signs, and the treatment to help depression. If you see someone that is depressed or you see them in that dark room, just go and open a window for them, or maybe just help them get out of bed one day, or just sit right there and talk to them. Anything can help with with a depressed individual, making sure that they are there, having somebody to talk to. Depression is not easily overcome. Some people will overcome it in 3 to 6 months. Some people will overcome it in years. It just takes time, and it's up to that person and that individual to know and what treatments works best for them.